Let's talk a little further about the stricter lockdown measures that are in force in Leicester because of a steep rise in the number of coronavirus cases in the English city recently. Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter Medical School, former consultant in communicable disease control at Public Health England, and he's also from Leicester. Hello, thank you very much for talking to us.
Good morning.
Is this the right thing to do?
We have no choice. When we have a rise in number of cases and it is increasing by the day, the only way we can control it and bring it under better control is to have a restriction of movements and find out. This is the most important thing. We should have been looking at the data as it arrived. So simultaneously analysing the data and therefore looking for where the hotspots in Leicester are and then bring in restrictions and control measures as soon as we know where the problem is and act there and then.
Is it still possible to do that, to look for where the hotspots are?
We have to, we've got no choice, and it is possible. And I hope right now, as we speak, they are looking at the data, looking at the postcodes, looking at the time, the person, the place, basic epidemiology, and then you identify, you map it out. We've got lovely software these days. You map it out where the hotspots are, and then involve the local people, because the local environmental health officers, the local GPs, the local public health people will know the nuances of that postcode area, and then you will know what they're up to, and you can then give them the better advice about why these cases are going up and what they should do and what they shouldn't do.
In the meantime, mobile testing units, I understand, are either they're already there in Leicester or they're on their way there. Plus, there is a plan to open a walk-in centre if it's not been opened already. People with any sign of symptoms have to go and get tested, don't they?
Yes, they do. But, you know, whilst they're sending what we call reinforcements from central London, it's very easy. What's wrong with having the GP practices undertaking the tests? All our patients know where their GPs are. It's a better location, easier to do, and it should be done. And I think it should be done across the country. We have set up a lovely primary care service in the United Kingdom. We should use them as much as we can and fully.
OK. How do you react as well to the particular reference to children in the Health Secretary's statement in the Commons last night? He said children had been particularly impacted by the local outbreak, hence the fact that schools, for most pupils, will re-close from Thursday.
So what has obviously happened is infection has been introduced in a school setting, and then the children in the school have got infected. The concerns are the children may take this infection to vulnerable parents and grandparents at home. And Leicester has got quite a lot of Asians, Pakistani, Bangladeshi, Sikhs, multicultural society, and these societies also live in large extended groupings. Therefore, all the more reason to be very cautious about that youngster going to school who may, and I use the word may, introduce the infection to their elder, more vulnerable parents, grandparents.
Right, so that the large extended groupings, this multi-generational households, which we see with Bangladeshis, Pakistanis, etc., that is potentially relevant to this spread of the virus again, do you think?
It may be, and you know, as soon as we've identified, analysed and worked on the data, and by the way, with respect to the data, we shouldn't only look at test data. There is a lot of other intelligence to be gathered from, for example, NHS 111 calls, for example, GP consultations. So put together the GP consultations, the NHS 111 calls, as well as the testing data, and you will get a finer, more precision as to where it is, why it is, and what we can do about it.
Thank you very much. Thanks for talking to us,
Thank you.
Dr. Bharat Pankania.